morning, everyone. My name is Nirav Shah, and I am the Director of the State of Maine's Center for Disease Control and Prevention. I'd like to provide everyone in the state an update on where we stand with respect to the COVID-19 situation. As of this morning, Maine CDC is now recording 499 cases of COVID-19 across the state. This represents an increase in 29 new cases since yesterday. Of those, 92 have been hospitalized at some point in the course of their illness. 158 have recovered, and sadly among those there have been 10 individuals who have passed away. Our thoughts and prayers continue to go to the families of those who are grieving that loss. And we remain focused on helping everyone affected by COVID-19 make a full and complete recovery. There are no new counties that have community transmission in them as of yet. The only two where community transmission has been detected remain Cumberland and York counties. And at this point, all but one county, Piscataquis County in Maine, has recorded at least one case of COVID-19. Since beginning our work, the Maine CDC has fielded over 4,300 consults from individuals and healthcare providers across the state. I'd like to turn next to a quick update on our laboratory work. Our laboratory remains prepared to accommodate over 3,000 tests for individuals with COVID-19. And we are also in the process of distributing results that we recently received from LabCorp. We will be informing healthcare providers who submitted those specimens to our laboratory of those results. We are also continuing to ensure that our laboratory is prepared to accommodate and test samples from all people across Maine for COVID-19, provided they meet the testing guidelines established by the US CDC. I'd next like to turn to an update on our distribution of personal protective equipment across the state. As everyone is aware, PPE, or personal protective equipment, is a vital resource that has been in short supply, not just in Maine, but across the country. This PPE is used by healthcare workers of all stripes who are on the front lines working with COVID-19 patients. And we have been attempting to distribute that PPE fairly and equitably across the state. Today, Maine CDC staff are pulling roughly 75 orders from inventory, and those orders will be shipped out tomorrow. Tomorrow, we will be pulling approximately 55 orders of PPE, and they will be shipped out the subsequent day, on Wednesday. Right now, this week, for the next few days, our focus of PPE distribution is on congregate care facilities, specifically long-term care, skilled nursing, and assisted living facilities. These are areas that we know across the country there have been large-scale outbreaks of COVID-19. And in order to make sure that we keep those residents, as well as the healthcare workers who are working in them, as safe as possible, right now we're focused on making distributions to those facilities. It's important to note that these distributions come on top of a very large set of distributions that Maine CDC made just last Friday, where we distributed approximately 109,000 pieces of protective equipment across the state. That's 7 full vans of PPE that we made just this past Friday, and we're continuing with that effort this week, and we'll continue to do so to make sure that healthcare providers have everything they need to stay safe. I'd also like to provide a brief update on our planning around alternative care sites. Maine CDC is currently working on plans for a module for alternative care to be activated in southern Maine. We're simultaneously working on plans for modules to be activated, one in northern Maine, as well as continuing planning for 2 other modules, one perhaps in western Maine and another in the 4th in eastern Maine. This is work that is being done in collaboration with a number of other state agencies, as well as healthcare institutions across the state. I'd just like to pause for a moment to thank those other state agencies who are helping from a logistics perspective, as well as those hospital and healthcare institutions that are helping from a staffing and planning perspective. What I will say is that there will be much more information about this process and this planning and this rollout coming tomorrow. Finally, I'd like to just provide a quick update on some of the vital resources and assets that we track. As of this morning, there are a total of over 300 ICU beds available in total in Maine, 120 of which are available. With ventilators, there are over 320 ventilators, 268 of which are available. Of these so-called alternative ventilators, there are now nearly 200 available. And as for respiratory therapists, there are nearly 130 available and ready to serve across the state of Maine. As I close today, I'd like to draw a specific focus to every single healthcare worker and healthcare provider who is on the front line right now. And I'd like to just take a moment to thank them, not only for their service, but for their courage. This is one of those situations where being courageous is not the same thing as being oblivious to risk. This is a situation where courage entails recognizing the risk and knowing full well that that risk exists, continuing to charge onto the front lines because they know that that is the right thing to do. And so on behalf of all of us across the state of Maine, to every single healthcare worker who is on the front line working on COVID-19, I want to tell you that we recognize the risk you are taking, and we commend your courage. Thank you for doing everything that you are doing. There are simply not enough spotlights in the state of Maine to shine a light on each and every one of those people on the front lines. But each of them in every corner of the state is doing heroic work. And I ask all of us to take a look around, take a look in our neighborhoods, in our families, in our communities, and take a second to thank each and every one of those healthcare workers for the risk that they're taking and the courage that they are displaying right now. This effort statewide could not exist without those healthcare workers who are on the front lines, and I personally thank them for their service. So with that, we will turn things over to our colleagues in the media who are joining us by phone, and I'd like to start with Brad Rogers from WGME. Brad, go ahead.
Hi, Dr. Shah. You're talking about PPE. Can you talk about the main companies and universities now manufacturing PPE for the state? And, you know, could you get those first shipments in? And really, how quickly could hospitals and the state run out of certain items?
Great. So Brad's question is about the manufacturing of PPE that is happening right here in Maine for Maine hospitals, for the healthcare workers in Maine who I just spoke of. And so, Brad, our strategy for PPE does not rely on any single source. Some of the PPE that we are distributing comes from the federal stockpile. Some comes from other sources that we have acquired across the United States. And some eventually will come from Maine manufacturers themselves. And the groups in Maine that are manufacturing these pieces of PPE are the names that we all know and trust across the state. Commissioner Heather Johnson at DECD has been leading the effort to organize that manufacturing capacity and make sure that it gets distributed to healthcare workers. That effort is underway. I don't have a timeline as to when the first masks or when a high number of masks will roll off. I do know that at least one manufacturer in the state has already been making masks on the order of several thousand per day for healthcare institutions across the state. There are many more that are also coming online, making other types of PPE, face shields, shoe coverings, things of that nature. I don't have those numbers right in front of me right now, Brad, but certainly I can get them, or Commissioner Johnson can provide those. But I just do want to take a second to commend the entire manufacturing community in Maine. This is a team effort. It's healthcare workers, it's public health planners, but it's also folks like this in the manufacturing community that are doing their part to keep healthcare workers safe. I'd like to turn next to Caitlin Andrews at the BDN.
Hey, yes, Dr. Shah. My question is about the quality of PPE that Maine received from the national stockpile. There were reports about some states getting rotten and unusable equipment. What was the condition of the equipment Maine received? And if some was bad, how much does that impact the overall shipment?
Great. So Caitlin's question is about the integrity of the PPE that we received from the national stockpile. The Strategic National Stockpile is a series of warehouses that are managed by the federal government that are designed in order to push PPE and other pieces of medical equipment to states in times of emergency. Early on, Maine requested distributions from the PPE. We received them and have been told, unfortunately, that no further distributions are coming in the near future. My understanding, Caitlin, is that the PPE that we received did not have any rotten or rotted out pieces of equipment in it. I will check on that with our warehouse management team to see if that is the case. I'm not aware of any such reports, but if that were the case, Caitlin, I will make sure that we communicate that to you. I am aware of those reports in other states, but I'm not aware that that affected the integrity of Maine's shipments. Again, we'll check on that, and if I am incorrect, we'll make sure we correct the record with you. I'd like to turn next to Steve Missler from Maine Public.
Thanks, Doctor. I appreciate it. I'm going to go for a twofer here. One is, the first question is as you probably know, the federal CDC basically greenlit the testing for antibodies to get a better picture of people who may have been exposed to COVID-19. And I'm wondering if Maine is participating in that effort or if it's too soon. And I guess the second question I have is if you could just clarify how many deaths and or cases have been in congregate settings.
Got it. Okay. So Steve's first question is around antibody testing. There are two different types of ways to test for COVID-19, really to test for almost any bug. One way is to take a sample of blood, or in this case, fluid from someone's nose, to see if there are particles of the genetic material of the virus in that sample. In this case, the RNA. That's one way to test. The other way to test is to see if, so the way that the body reacts to any kind of particle is to create its own defense. That's one reason, for example, after you've been exposed to something, many infectious diseases, you don't get them again, because the body is ready with its own defense line to respond. So another way that we can determine whether someone has been exposed to any virus like COVID-19 is to see if the person has those so-called antibodies in their blood. Both types of testing strategies are really vital. Right now in the United States, it's really just the genetic fingerprint mode that's being used. But Steve, as you note, in recent days, the United States FDA has approved certain tests that will detect the body's own antibodies. And so we have been following those developments very, very closely. We're following them partly from a scientific viewpoint to determine whether we'll participate in some of the population health studies to validate those devices, but also from a purchasing standpoint to determine whether we might want to acquire those for healthcare institutions in Maine to get a better handle on what's going on. Right now, those devices have just received FDA approval. The first such one just about 72 hours ago, and it's not even really being offered for wide-scale distribution. But we are keeping very, very close tabs on that. If and when those machines become more widespread, they are definitely a strategy because it allows somebody who might not have symptoms to be able to be tested to see if they've been exposed and have the natural antibodies, and that allows them to go back into work much more quickly. So there's a lot of interest and excitement around that from a scientific perspective. We're keeping very close tabs on it, and we'll definitely, again, have updates. Steve, your second question was around the deaths and whether any of those individuals who have passed away have been in congregate settings. I'm going to check on that, Steve. I hesitate because generally we have not revealed anything about the place or location of individuals who have passed away. Our practice and this practice of most states have been to reveal their general age range, their gender, their county, and whether they were hospitalized. So I don't have that information immediately available, Steve, and I'll also have to check to see if we are able to release it at all. But so I just want to be straight with you about where we are. If we are able to release it, we will do so. I'd like to turn next to Amy Brown at WERU.
Thank you, Dr. Shah. I have two questions, if I may. The first is, you've said that the numbers being reported are by the county of residence, not necessarily where the person is located. Do you have a sense of how many people are being reported on the CDC website as being positive per county might actually be located elsewhere? For instance, are we seeing any people who are in Florida at their winter homes still included in Maine's numbers? And then also, if you could give an update on what's being done to help people who are experiencing homelessness right now, if there are any proactive steps being taken to help keep them safe.
Great. So Amy's first question is around how we report cases on our website. And Amy, as you know, what we report is based on someone's county of residence. And so it could be the case that someone in York County were hospitalized in, say, Cumberland County. That can and would happen, but we would record that on our website as a case in York County. That's largely the way that most other states do so, and that has been the practice at Maine CDC, not just for COVID-19, but for virtually every other infectious disease. We look to the county of residence as we are recording cases across the state. And in this situation, we are looking for, we try to use the same model for COVID-19 as we would with anything else. The way I like to think about it is that even though this virus may be new, the way in which the public health system responds and thinks about COVID-19 is not necessarily new. Now, with respect to individuals who are experiencing homelessness, as I've mentioned, there are cases among individuals experiencing homelessness who have been residing at or affiliated with, for example, the Oxford Street Shelter in Portland. We at Maine CDC, Maine DHHS, and state government overall are working very closely with city officials in Portland, as well as the management of the Oxford Street Shelter, to support their response. We touch base with them on a frequent basis to make sure that the individuals there who have been exposed or who have been confirmed are receiving all the supports they need, medical, social, and otherwise. And we're continuing to support their response to make sure that city officials have everything that they need to keep their Oxford Street residents as safe as possible. I'd like to turn next to Paul Dwyer at WABI.
Good morning, Dr. Shah. So after we saw the biggest day-to-day increase on Friday of 56 cases. We had some low numbers over the weekend, including only 14 yesterday. Is there any correlation between smaller numbers of case increases on weekends, or is this a positive sign, or is this just statistical variation?
Great. So, Paul, I'm gonna end my answer with where you ended, which I'm gonna start my answer with where you ended, which is statistical variation. So, I want to be so. And Paul's question is about whether we can read anything into the day-to-day fluctuations in the numbers, especially what appeared to be lower numbers on the weekends. And I want to say straight out at the beginning. The Maine CDC laboratory was operational all weekend and running samples. So we don't have any reason to think that the weekend numbers had anything to do with the fact that it was the weekend. Maine CDC staff were at the laboratory. I thank them for being at the laboratory running samples. And so, Paul, it does lead to the question of whether there is anything we can read into these fluctuations. And my view is that right now, where we are in this outbreak, is that it probably does represent more day-to-day variation, just the natural flow of an outbreak. That's another way of saying, I'm not sure. And for someone involved in science, the three hardest words in the English language to say are, I don't know. But in this situation, Paul, we don't know. I'd like to turn next to Samantha Hogan at Pine Tree Watch. Samantha from Pine Tree Watch. Okay, we'll loop back to.
No, I'm sorry, it just didn't pick me up. Can I ask my question?
Yes, please, of course.
Okay. Yeah, can you define what you meant by modules for alternative care sites? And then also, will the state be able to supply staff and manage multiple sites at the same time if multiple locations do experience a medical surge simultaneously?
Great. So Samantha asks about the alternative care site and specifically the modules and the staffing. What a module for an alternative care site is that it contains roughly 50 stations in which individuals can be taken care of. It comes as one large module that we then sub-split so that we could distribute it across the state in different numbers. So it need not be exactly 50. It could be different numbers based on different parts of the state and what they are experiencing at any one time. And a module includes not just a cot, but also other pieces of medical equipment that would be needed to care for that patient, except for PPE. So the modules have to be supplemented with PPE. Now, Samantha, you ask a great question about staffing, and this is where I again want to thank our colleagues in the healthcare world, healthcare institutions and hospitals, because the staffing model would be joint. It would partly be staffed perhaps by some individuals from Maine state government, but it would also be done as a joint effort with staff from hospitals and other healthcare systems across the state as a joint effort. Again, there's much more detail to come on that. These staffing plans, as you can imagine, are quite challenging, and I just want to thank all of the representatives of the healthcare institutions and hospitals across the state for working with us on thinking through the staffing plan, because that is, of course, vital to the entire effort overall. I'd like to turn next to Megan from WMTW.
Thank you, Dr. Shah. My question is about fabric masks that a lot of folks have been wearing since the federal CDC came out on Friday with a voluntary order that says, you know, you can do this, but it is in addition to not in replacement of social distancing, hand hygiene, et cetera. Can you just clarify your thoughts on these fabric masks, and if there is a safe way to wear them, what would you suggest people do, make, or how do you view this? Is this a false sense of security?
Great. So thank you for that question, Megan. And Megan's question is about recent guidance from the U.S. CDC around the use of cloth face coverings. These are not so much masks as much as they are cloth barriers that individuals might be able to wear. And so, Megan, what I want to do is just share a little bit about where I think this is coming from and what the utility might be. The first really important thing to point out about cloth face coverings is that they are not necessarily designed to protect you. What they are designed to do is to protect other people from you. The rationale behind this is based on some data that have emerged and continued to emerge over the past several weeks, now months, showing that people who do not yet have symptoms of COVID-19 can quite readily pass it from one person to another, even before they have symptoms. The cloth face coverings are designed to minimize the chance that someone who doesn't have symptoms could transmit it to somebody else. But the CDC's guidance here really applies to individuals who are in group settings. So it's not so much that you need to be wearing a cloth face covering at home, although you're certainly welcome to, but it's really more when you have to make that trip to the grocery store, as infrequent as that trip should be, when you have to go into some area where other people outside of your household may be, that is a prime time to don one of these cloth face coverings. As you note, Megan, I really want to stress that these masks, these face coverings, are not in place of physical distancing requirements. They are in addition to physical distancing requirements. For that reason, we do ask everyone to take a look at a number of videos out there that demonstrate how you can go about making one of these. The U.S. Surgeon General, Dr. Jerome Adams, has a video that we've actually distributed to state employees to walk them through, if they wish to, how such masks can be fashioned, and emphasizing when they should be used and noting that they are not a replacement for physical distancing and should not give anyone a false sense of security. They are, in this world, yet an additional layer of protection, another layer of the onion that we can rely on here. So thanks for that question, Megan. I'd like to turn next to Kevin Miller at the Press-Herald.
Hi, Dr. Shah. Thanks for taking our questions. One kind of a quick question about ventilators, and the other one just about folks who have recovered. So on ventilators, obviously you gave us the update on the latest figures. Are you hearing any concerns about the other equipment that has to go with this ventilators in addition to the respiratory technicians, like the tubing and other sorts of equipment, and whether those are in good supply? And then my question about folks who have recovered, I think it's great that we're seeing larger numbers. I think about a third of our cases now are now being listed as recovered. Are there special things that folks who have recovered, are they supposed to be doing things in particular? When is it safe for them to go back to work? Can you just address those kinds of issues?
Thank you, Kevin. Kevin's first question is around, in addition to the ventilators and the respiratory therapists and healthcare workers who operate them, are there other pieces of equipment that are also needed that may be in short supply? And the answer, Kevin, is that that's a concern. It takes a lot more than a ventilator. It takes a lot more than the machine and people to make a ventilator operate. So there is tubing, there are connectors, splitters, various other pieces of plastic that are needed to make a ventilator work and support the life of a patient. Some of them I want to just zero in on very, very quickly. Well, a lot of them are some of these pieces of plastic. And so early on, we received outreach from biomedical engineers, many of whom at the University of Maine, who wanted to investigate the possibility of using 3D printing and digital manufacturing technologies to manufacture those. One of our team members at Maine CDC has been speaking a lot with those engineers to see what could be produced more easily, such that if there were a national shortage, our engineering colleagues could 3D print those. I'll try to get you some more information about those discussions, Kevin. But yes, suffice it to say, it takes more than just a ventilator to keep a person alive. And so we're looking at the Strategic National Stockpile as we're working with them to look at their supplies of other things like tubing. And then if we detect that those are in short supply, trying to look around the corner to try to order those things now before we need them. Your second question is about recovery. And as you note, we now have 158 individuals in Maine who have recovered. What that means is that once they have been deemed to be recovered, pursuant to U.S. CDC guidelines, working with the Maine CDC epidemiology team, they are able to resume their normal lives. Where possible, they can go back to their workplace. If their workplace is still allowing people to come back in, they can feel free to go grocery shopping if they need to. Again, wearing a face covering if they wish to, but they are viewed as if they had not had the disease at all from an epidemiological perspective, and that's the advice that Maine CDC epidemiologists provide. We are thankful that 158 such individuals in Maine have recovered, and we are continuing to work with the remainder to try to get those numbers as high as we can. I'd like to turn next to Jordan at the Portland Phoenix.
Hello, thank you. I understand from the briefing on Friday that you purchased a large number of KN95 masks, and I was wondering about your decision to purchase that kind, because I didn't see them listed on the FDA site as an approved alternative to N95. So I did see that 3M issued a bulletin saying they're equivalent. And also if you would be able to disclose the supplier and the price per mask, if you could.
Sure.
Thanks.
So Jordan's question is about the use of what are so-called KN95 masks. And Jordan, I want appreciative of your question. I want to say right up top that one of the things that allowed us to get comfort in moving forward with this purchase have been a number of pieces of guidance from the federal government on the allowability, the applicability of using KN95 masks in healthcare settings. The first are some statements from the National Institute for Occupational and Safety Health, Occupational and Health and Safety, I'm sorry, a group called NIOSH. NIOSH has indicated that KN95 masks can be used in healthcare settings interchangeably with N95 masks. In addition, last week, the U.S. FDA actually updated its guidance after a number of states, including Maine, asked this exact question about the regulatory allowability of KN95 masks for importation. And what the U.S. FDA said is that KN95 masks, from a regulatory perspective, were an allowable substitute for N95 masks. So it was on the basis of those guidance documents from the federal government, as well as the fact that a number of other states are importing such masks, that we felt comfortable moving forward. I have to check with our procurement folks to see if I'm allowed to reveal the supplier. I believe so, but I want to make sure I am. So Jordan, if you could follow up with Robert Long, if we are able to reveal the supplier, we will absolutely do so. No hesitation. I will release any type of information on this, provided we just check to make sure we're allowed to do so. If so, we will provide all of that for you. So, you bet. I'd like to turn next to Kate Koff at the Ellsworth American.
Thank you, Dr. Shah. So there was a study published in the Lancet Infectious Diseases in March that found the viral loads in the swabs, the nasopharyngeal swabs from patients that had severe cases of COVID-19 were an average of 60 times higher than those of the mild form of the disease. I'm wondering if the results from swabs being processed by the Maine CDC and by the commercial labs that we're using include the viral load counts, and if so, what you're seeing, and if they don't include that information, are you saving the swabs for future study?
Great. So Kate's question is around what we can glean or what is the relationship between how severely ill somebody is and how much virus they might have in their nasal specimen. And as with a number of diseases, whether it's tuberculosis, measles, the flu, HIV, a number of diseases out there, the sicker you are tends to correlate with the number of times the virus has reproduced in your body. That's the same actually for a number of other viruses, even in the same family of coronaviruses, like COVID-19. In this situation, what we've seen is that the more ill somebody is, the more virus they've got in their body. Now, that may not seem like a stunning finding, but it does have important implications for disease control, because it really means that the individuals who are the sickest are also the ones who might be the most able to transmit the disease to others. What this means to me is that what we really want everyone to do is, of course, to stay inside at all times. But this applies even more if you're really not feeling well. If you are really, really sick, this is a time to make sure you are staying in and taking extra care not to expose other people in your household. Now, Maine CDC has been working with two different scientific entities to try to characterize what we know about the specimens in Maine, both from this intensity perspective, how much virus is there per milliliter, as well as from a genetic perspective. We also want to get a better sense for which exact virus in Maine is circulating. Where did it come from? How did it spread into Maine? Because understanding those patterns for COVID-19 will allow us to do better planning for the next outbreak that comes up. So we're working with scientific experts, for example, at the Jackson Laboratories here in Maine, to get a better sense of the genetics around the virus that's circulating here in Maine right now. I'd like to turn next to Pat Callahan from News Center. Pat?
Yes, Dr. Shah, sorry, I had to unmute you. Thanks for taking the call. When we go outside, we are finding most people are being diligent about their physical distancing, but we see those who are not. Do you suppose there's a false sense of security coming from the fact that our numbers remain relatively low compared to some areas, or the fact that you've only identified community transmission in 2 counties? Do you suppose that there needs to be a way to express how many cases we believe there really are, apart from the ones that have been confirmed?
Sure. So Pat's question is around what we've seen around physical distancing and the notion that perhaps folks are not taking physical distancing enough, taking it seriously enough, given perhaps the fact that Maine has had fewer cases than some of our adjoining states in this neighborhood. And Pat, what I would offer there is I certainly hope that's not the case. I hope that folks recognize how serious of an illness this can be and that they do take it seriously. I actually spoke to a friend of mine over the weekend who she and her husband are both physicians, and she and her husband both have had COVID-19. And what she told me was, and I don't want to mince words, she said, Nirav, this is really bad. She said repeatedly, her and her husband have woken up in the middle of the night with shortness of breath, wondering whether one should take the other to the hospital. And these are both individuals who are physicians, and they both expressed to me how much worse they thought this was going to be than what it really was, how much worse it is compared to what they thought it would be. And so, Pat, I hope that there is not anyone out there who is taking a look at our relatively lower numbers compared to Boston, New York, and others, and saying this is not a risk in Maine. I say that because in any outbreak situation, we are only seeing a fraction of the cases that are actually out there. I also say that because before we determine when something like community transmission is occurring, we know that it has probably already been occurring for several days, if not longer. And so even if you happen to be in a county where community transmission hasn't been detected, even though there have been cases, or you're in a county where there aren't that many cases yet, what we know from other outbreaks is that there are almost certainly cases around you. And I ask everyone to make sure they are taking every step possible, as you already have been for several weeks, to keep everyone in your family safe. I have to say, this conversation I had with my friend and her husband was really eye-opening for me. It's one thing to read about some of these numbers in the data. For example, to read that of 500 patients who might have been hospitalized, a very high number, 40%, were in individuals between the ages of 20 to 50. It's one thing to read about some of those sterile numbers in a journal article or see them on the news, but when you hear a friend and her spouse talk about how bad this illness has been, it's really galvanizing. It made me, I will say on a personal note, recognize how much that I wanted to make sure that I kept my family safe. It also is the reason why today I am taking an extra moment to draw the spotlight onto the healthcare workers who are exhibiting unbelievable courage and nobility by taking risks and showing courageousness by continuing to go to the front lines every single day. And so on behalf of everyone working on COVID-19 and on behalf of the rest of us in the state of Maine, we thank you for your service. So thank you very much, everyone, and I'll look forward to speaking with everyone tomorrow. Thank you.